Fatima, a 25-year-old pregnant woman on her 24th week, suddenly felt immense abdominal pain and was taken to the emergency room. Upon further checking, it was found that her baby is in a breeching position. What does breeching mean? How can we help Fatima, and how does a normal labor occur? We need to start from the beginning, in a process called fertilization. It is the fusion of female's egg cell and male's sperm cell. The fertilized egg then travels in a structure known as the fallopian tube down to the uterus, where the fertilized egg implants or attaches itself to the walls. Normally, when an egg cell is not fertilized, the uterus will eventually move or contract, shredding its walls, represented by a bloody substance that we call menstruation. This does not happen in pregnancy because of two female hormones. These sex hormones are progesterone and estrogen. A high amount of progesterone stops the contractions from happening, and estrogen, on the other hand, starts and promotes contractions. Most of the time during pregnancy, the amount of progesterone is larger than the estrogen, which means the contractions will be stopped, keeping the growing fetus inside the womb. But in the last months, the amount of estrogen overtakes the amount of progesterone. This change promotes and starts the contraction of the uterus. Another major hormone that helps in giving birth is a hormone coming from the neurohypophysis or pituitary gland of the mother's brain. This hormone is called oxytocin, which starts contraction. Surprisingly, the fetus also gives up hormones such as oxytocin, cortisol, prostaglandin, which are all helping to start contractions. Contraction starts from the top or fundus, going to the bottom or cervix. These are called Braxton Hicks contractions, which pushes the fetus downwards. Labor is divided into two stages. In the first stage, the contraction pushes the fetus against the cervix. This irritates the cervix and signals the brain to release a huge amount of oxytocin, making next contractions even stronger. The second stage of labor starts when the opening of the cervix enlarges or dilates, that the opening becomes the same size as the fetus's head. This means that pushing the fetus out would be so much easier. Also during labor, the abdominal muscles also start to contract, helping the process. This is caused by the pain coming from the cervix getting stretched. The heart starts beating faster, as much as 150 beats per minute. This is caused by the fight or flight reaction of the sympathetic system of the brain. After all the intense events happening inside the woman's body during labor, the shift of hormones, each contractions with at least 30 pounds of force, the pain considered to be one of the most painful thing a human can experience. After all of this, finally, the baby is born. Let's now talk about Fatima's condition. This is called breeching. Let's know what it means. Breeching can be dangerous as the head works as a wedge, which makes the labor easy. Without it, the head goes out last and can cause hypoxia or loss of oxygen and congenital conditions. How can we treat it? One popular treatment is called the breech tilt. This is a maneuver done by the mother. This is done by first lying down on the floor, folding the knees and raising the hips. This position is held for 20 to 30 seconds. This is done 1 to 3 times a day. After learning about her condition, Fatima followed these instructions and eventually she gave birth to a healthy baby.